Why do I start with the GCCG or inspire me to do this? Basically, one of my dreams is always trying to do things for global perspective, not just for the US or European or some continental specific. But I hope we can come up with the global consensus clinical guidelines, not only for the North American or the European, but for global dentists and also patients. So I had a chance, and actually back in one of the consensus conference, Lonnie Yu and I was in that room together, and we're doing a systematic review, which is part of the things we do quite often. And I kind of inspire saying, if we can do that on the systematic review level, why don't we do it for the different outcome by using the patient as our endpoint and provide the clinical guidelines, not only for just us, but for everybody, including patient. So the patient knows what can we do to help them as a dentist, not just saying place the implant and making money, but it's a way can we help you to rehabilitate and give you some healthy smile and good function and chewing and speech. So Ronnie and I has a golden opportunity. We both are president of a different organization, so we can use that position to help kind of put a post together, and so we can have this GCCG consensus. So in patient as the outcome measures for the global perspective, not just the way we do as a dentist. Basically, the reason is we have a lot of patients suffer from the maxilla edentulous, and people has different options, different treatments. So we think about if we're going to target and make global impact, why don't we looking into the things that affect a lot of the patient? And certainly will impact a lot of the dentists who provide the therapeutic approach. So that's the reason we choose the fully edentulous maxilla for our first GCCG. And we invite so many experts to come in, and from different aspects, we have a full group. So we're looking into the amount of the implant, the timing, the prosthesis, and the graft versus the conventional. So this type of the things for people to really understand. They have options, and why do they choose in a certain treatment modality, and to benefit them as a patient, and also guide clinician to be a better clinician to provide the care a patient needs. On the personal level, what leads me to do this GCCG? I've been involved in organized dentistry in many different organizations, and I've been speakers and globally to lecture and to help dentists to learn the new knowledge, new skill, and to train their patient. But I think I can only do so much. I can only reach so many people. The way we can do as a globally is to create we call it guideline or suggest treatment, we call the flow chart or diaphragm, and given up to all the dentists and all the patients. So we can reach not just one area, we can reach the worldwide. Yes. So it's much better than for me to go out and lecture. How many people can I lecture to? But this can have a huge impact and more global spread throughout the social media, throughout the publication. People can learn this knowledge, and so the patient can be better served and for getting the better treatment for them and for more long-term stability. If I look back for the last 18 months, what made me happy or excitement? Let's go talk about the excitement. It's a new idea. It's a brand new idea. And it's different than what I used to be on systematic review. We're looking at treatment efficacy, but this time we're looking into the treatment outcome. What patient wants. What really patient wants. We put patient as our priority. So it's a little bit different. And what makes me feel a little bit challenged? Because it's new. And a lot of people don't know how this works. And we go back to the old habits. We want to talk about efficacy, the certain treatment, the certain small details, but we all forget what a patient wants. They want a small detail such as what material we use, what pin we use. No, they want to know what treatment is best for me long term and I can maintain. So that's the different approach. And that a little challenge is trying to understanding all these things. It's a challenge. It's new to me too, even though I've been here for 40 years. And it's excitement, but also a challenge because excited, I learn something new, but challenging, I have to read a lot of information about how the process goes. What I think the atmosphere so far, I think everybody come in with the kind of a surprise and unknown because they don't know what it is. And they're starting to get merged into it. So everybody was get excited and we talk. Actually, we meet many friends because this is unique. We not only bring the periodontist, we bring the oral surgeon, we bring the restorative doctors, we bring even general dentists. We have everybody from different backgrounds get together and express and exchange the idea, but with this common goal, what can we serve the patient better? And we eventually become good friends. So far, I see everybody after almost 1.5 days, they get excited and friend collegiality is there. People get smile and people, they debate with a laugh. And even though they didn't agree, but they eventually learn how to respect the outcomes because they learn about people do different things. People have a different idea and opinion, like all the consensus campers. But now they know what a patient wants. The key is always the patient. What a patient wants. What do we do to help that individual, that patient? And don't go beyond that because one patient at one time, the way you do. And I think for me, I see everybody was so happy and the atmosphere is actually very unique. People want to get even drink after the consensus. Everybody's tired, but they still want to get familiar with what you do and what the consensus means. So that's excitement.